I work with the New Mexico Livestock Board, and I work with the small ruminant portion of the program within the New Mexico Livestock Board, meaning that I have been out helping at the Navajo Nation a couple of times when they have done herd programs. I have given this kind of a talk or similar talks in the past regarding anything that deals with small ruminant management. And currently I am a participant in a program that the state has that's called the Oveja Project, and it's trying to increase and improve and promote the sheep industry in the state of New Mexico. So this is definitely a topic that I feel quite comfortable discussing. And so hopefully we'll go through the presentation. If there are any questions, please don't hesitate to ask me. If I don't know the answer, I can probably find it for you. So without further ado, let's go ahead and get started. So one of the things that we're looking at is why establish a herd management program. You know, many of us have been dealing with ruminants and have been raising sheep and goats the way that our parents did and the way our grandparents did, and they never did any sort of practices. So why should we? And that is a very, that is actually a pretty good question to ask. The reason is if you do establish a health management program, it does decrease on the losses that you suffer on an annual basis. It improves on the profitability and revenue that these animals will actually bring you. There's an improvement in the viability of that lamb and that kid crop, so you should have more animals being born and therefore fewer animals dying as well. It helps to prevent a lot of the diseases that are fairly common, at least the ones that deal with management, and that's something that we can definitely do through a health management program. This is typically done through successful vaccination programs, parasite control programs, and nutritional management. So a couple of the different things that we deal with as individuals who either own animals or as practitioners, veterinarians and such, is examining the sheep and the goats. So the first thing that we typically want to do is a distance examination. And sometimes that step is kind of taken away from us as practitioners. Sometimes these animals are just presented to us. You know, I've got a sick goat. Here it is, figure out what's going on. But if that's not the case and it's somebody who's looking at the herd as a group, which is what we try to do, either a flock or herd management program, what we want to see is looking at that animal from a distance, occasionally just seeing how it interacts with others. We know that sheep are flock animals and they tend to stick together. If they ever panic, they get to cluster quite a bit. And we know that goats, for the most part, tend to stick together, although when they're out grazing, they tend to spread out a little bit more than sheep do. So different things that we might find as these animals get herded, we might see that there's one that's lagging behind or one that's kind of got droopy ears, weepy eyes. We can hear coughing going on, and occasionally we can find the animal that's coughing within that group. We might notice some labored breathing. We might notice some lamenesses. You know, so for us, it tells us, although we might be presented with one animal, there might be other animals that we need to look at as well. Additionally, cuts down a little bit on the initial stress. These flight animals have a tendency to become highly stressed very quickly. And so if we can perceive that there are some issues before we even put our hands on the animal, then that'll give us a little bit of guidance as to where we need to go from there. So one of the first things that we're going to be looking at, and this is across the board, anytime that you're dealing with any sort of production animals or livestock, you want to know what their body condition score is. The first one's going to be visual, in animals that are either short-haired or in animals that do not have very long fleeces. We might be able to do this quite simply by looking at the animals and seeing what their body condition is. Typically, when we're studying a body condition, we're looking at it from 1 to 5, with 1 being an animal that's just emaciated, bony, ribs sticking out, there's no fat there, to an animal that's going to be 5, which is just essentially obese. That's an animal that's already over-conditioned, and that also has its series of problems. So typically, and again, it depends a little bit on what the management is going to be, whether it's going to be a show animal, whether it's going to be an animal that's going to be used for meat, whether it's an animal that's in a reproductive state, such as a pregnant doe or ewe versus an animal that's not bred. we're typically going to be looking at an animal to be in a body condition score anywhere between 2.5 to 4. And what we typically want to do is see that the entire herd, based on their age group, falls within those parameters. So again, in animals that have woolly coats or that have long hair or curly hair, it's not always that easy to tell. So at that point, visual doesn't really help us very much, and we really have to get hands-on. We're going to be placing our hands over the sternum so that at the level of the chest bone, we can see what else is going on there, if there's a lot of fat adhered to that. We're going to be touching around the ribs to see how defined those ribs are, and definitely running our hands across the back to determine what the layers of fat are. And this is a common practice that you guys should be doing with your animals if there's any source of concern. We find that the herd or the flock as a whole has a tendency to have a lower body condition score. That might indicate that we have either some nutritional issues that we need to address, or it might indicate that we're looking at potentially parasitic issues or something along those lines that we need to look at. Additionally, if we find animals that are over-conditioned, then that might be something we take into consideration. You know, are these animals going to be at risk of an overeating disease? Are these animals going to be at risk at the time of lambing or kidding? So it's important for us to have a general idea. We typically do want to be, ideally, I would say 3 to 4, so anywhere between 2.5 to 4 is considered acceptable. And this didn't want to move. Let me see. All right, there we go. Okay, so after we look at the body condition score, another thing that we're going to be very interested in looking at is examining the skin and the quality of that hair or that wool. That gives us a lot of information. Dull, brittle hair coats usually indicate that there might be either some nutritional deficiency, there's been a nutritional stress of any sort. Animals that are highly parasitized can have ugly skin coats or ugly hair coats. There might be issues with parasites. And so this gives us a lot of information. If we find, for example, animals that have patchy hair losses, we can determine whether or not that's caused by something that's itchy, or we can determine whether or not that's caused by a bacterial or a fungal infection. So definitely looking at the skin and the hair or the wool on those animals, it should be nice and uniform. Obviously, you know, we would expect that it would be affected by weather, but you shouldn't find patchy hair losses. That would give us an idea that there's something else going on. Ideally, if we find it in one animal, then that's the animal that we have to address. If we find it in multiple animals, then we have to start looking at whether we've got a herd management issue going on. Other things that we're going to want to check on, and this is fairly simple, check the tail and the legs for any evidence of diarrhea. That's usually not a sign that we want to see. It'll give us an idea whether we're feeding something that's too rich, or again, whether we have some sort of gastrointestinal issue that we need to address. When looking at the individual animal, we're going to want to take a look at the teeth, find out, is this a young animal, an older animal? And that might also give us an idea, you know, if we've got a significantly old animal, like an old ewe that's just a gummer, she's got no teeth, we won't really be anticipating that she would be in a body condition score of 4. Color of the mucous membrane, very, very important. So we're going to be looking at that eye or the eyelid, and we're going to be looking at the gums. That gives us a lot of information as well. If we're finding nice, pale pink, moist gums, that's a good sign. Again, it's going to vary a little bit on breed, whether they've got darker gums or not, or eyelids. And then if we're finding something that's either red and injected, that might give us an idea that this animal might have some sort of an infection going on or an inflammation. And if we find something that's yellow, it's going to tell us that we might have potentially some liver-related problems or other problems that could be causing these different changes. Any sort of discharge, again, we need to take into consideration. If it's been a windy day, we wouldn't be surprised that we're seeing any sort of discharge from the eyes, or maybe a little bit of a clear nasal discharge. But if we're having a frank, snotty nose and very goopy eyes, or we've got drooling going on from the mouth, those are things that are of concern to us. And then any smells. So any smell coming, for example, from the mouth is likely indicative that we might have some problems going on there as well. Okay, so one of the first things that we look at when we're doing a herd management program is going to be our vaccines. What vaccines do we need to do, and why do we need to do them? First of all, vaccines are never going to be 100% effective. You can't say that you're going to clear the disease entirely, but it may reduce the incidence or the severity of disease, kind of like what we heard from COVID, where if you get the vaccine, potentially, if you get the disease, it's not going to be as long in duration or as severe. Those are similar strategies to what we're looking for in vaccines in ruminants. It can vary according to the region of the country that these animals are being raised in. Luckily for us here in the Southwest, we don't tend to have too many of the problems that they tend to have probably closer to the Midwest or the East Coast. Vaccination protocols make record keeping very easy. It is something important to take into consideration, you know, when you're vaccinating, what you're vaccinating for, and who you're vaccinating. And the protocol can vary depending on what the purpose of the flock is. Are you raising a flock that's just, or a herd that's just grazing for the sake of grazing? Are you raising animals that are going to be show animals? Are you raising animals that are going to be for meat? Are you raising goats that are going to be for milk? That may change when and how you vaccinate animals. And then obviously you need to take into consideration the risk factor management. So either animals that tend to go to shows or animals that have been purchased through a sale barn are going to be exposed to a lot more infections than your average backyard flock that has been grown and raised on site. So what all can we vaccinate against? Across the board, the one vaccine that is considered the vaccine that you do not want to skimp on in sheep and in goats both is going to be your CD&T. And the reason for that is these small ruminants are very susceptible to clostridial diseases. Many of you may recognize it as disease, or where they get enterotoxic, meaning that they eat something or they bloat, and they tend to have bacteria that will proliferate, and that can cause severe diarrhea, it can cause bloody diarrhea, it can cause bloating, and ultimately it can cause death. So for us, that's definitely a major source of concern. And then tetanus is something that they can also be susceptible to, and this typically happens at the time of dehorning, anytime they have wounds, anytime that, for example, rams or bucks are getting castrated. Those can be typical times when they would end up being susceptible to tetanus. So although vaccines are not without their side effects, this is definitely one that if I were going to be asked straight out, if you were only going to give one vaccine to sheep and goats, which one would it be? This is the one that I would point you at. There is also an 8-way vaccine. It tends to have a lot more of those typical clostridial diseases, which are bacterial diseases, but realistically, sheep and goats are not as susceptible to that whole list. And I've got it down at the bottom. You can see right here where it says contains Strovii, Septicum, Novii, Hemolyticum, Perfringens, CD, and Tetany. So the 3 that I would look at are CD and Tetany. Vaccines are not without their share of risk. Likely most of the risk that you'll end up finding is going to be abscesses wherever that vaccine was given. Occasionally you'll have animals that will be a little on the febrile side, so you get a little bit of a droopy ears at half mast, really not feeling that great, acting a little puny, not interested in feed. That's not uncommon. But that should typically be self-limiting and should go away in a couple of days. And if push comes to shove, you give them anti-inflammatories a few days and they should feel better. So a second one that may or may not present, and this is not one that is typically given in every flock, and part of the reason why it's not given in every flock is because some flocks really don't have issues with pneumonia. But if they do, there is a possibility of giving the para-influenza one, and that one can help against some of the bacterial and viral pneumonia agents and help boost the immune system a little bit. So the way it's typically used is giving half the cattle dose, and that one's given intranasally. And so it reduces the para-influenza portion of the virus in the dams. It does provide fairly decent colostral immunity, so it's not bad. But again, this is going to be something that's going to be flock specific. If it's an issue where you're losing a lot of animals due to respiratory diseases, secondary bacterial diseases, then this might be a situation where giving the vaccine in advance would be of benefit. Pre-weaning vaccines, and again, we were talking about overeating disease, and when this presents or how it presents is either animals that have a radical change in their diet, or animals that are eating something that's too rich, or animals that, for example, have just been weaned. And that's what we run into with lambs and kids. And so That's typically when we're going to want to give a vaccine, is before we go ahead and wean these animals. They get the first shot, and then they can typically get a second shot about 4 weeks after that one, a booster. And that, again, will hopefully prevent the incidence of the disease, at least in the majority of the cases. Other vaccines that are optional, one of the ones that you may run into, and you guys can take a look at it at the picture right here, where we've got pretty ugly looking, very sore mouth. And this is typically called, as the name would say, sore mouth. It's called contagious ovine eczema, and it does exist both in sheep and goats. And it is exactly that. It's pustules and blisters that develop at the level of the lips, the nose. Those are going to be typical signs inside the mouth as well. And they just kind of pop open, rupture. But you can imagine that having all this raw, blistered skin is fairly painful. And so these are animals that have a tendency to start losing weight because it doesn't feel good for them to eat or drink. For the most part, it is a self-limiting disease. So it just kind of has to run its course. It's unfortunate once it's in the flock or the herd, it does not go away. And it is something that is infectious to humans. So if you're dealing with this kind of a disease, you don't want to use your bare hands to clean this off or to treat these animals. Or if you're bottle feeding, you want to be very careful about it. But there is a vaccine that's out there. Again, you would not use this vaccine unless this were a true problem within the herd. You want to be very careful about that. The vaccine does exist. It's a live vaccine. So again, as a human, you have to wear gloves because it could pass to you, and it's going to be blistering of the skin, miserably painful, not a comfortable disease to have. E. coli vaccine, again, not something that we tend to deal with too much in the Southwest, but it does exist. And if there's a need within the herd or the flock, again, it would be something that you could give. Rabies, we are not traditionally in an area that's endemic for rabies. We do have rabies cases, and those are usually mentioned by the Department of Health, where they say that there's XYZ county within the state that had a positive case for rabies. And if that were the case, then it might be indicated to do rabies. But traditionally here in the Southwest, we don't tend to vaccinate our flocks against rabies. So now we get to the nitty gritty. The biggest problem that we tend to have, and the biggest cause of death and illness in our flocks and herds, is going to be internal parasites. Typically, the signs that you're going to find are diarrhea, weight loss. These animals are anemic. So going back to when we were looking at their eyelids, they have very, very pale eyes. They have poor weight gain. Many of the ewes or the does will not get pregnant, or they'll abort. It can affect their milk and their fiber production if the parasite burden is too high. And many of them are similar to those in cattle, but they are host specific. Typically, they tend to cause problems in some of our younger animals. So usually you're going to be looking at either youngsters, weanlings, young adults, not typically so much of a problem in our older animals. And control programs are good. I think they're fantastic. Luckily, here in the Southwest, we don't tend to have the parasite issues that they have on the East Coast. They have a lot more moisture. They have a lot more humidity. They have temperatures that are more conducive to harboring a lot of those parasites. We don't. We have sunshine and dry temperature, and that favors us like you would not believe. So typically, when we tend to find parasite issues, it's going to be either because we have a population density issue, where we just have a lot of animals that are crowded together, where we have multiple age groups. So we've got youngsters, and then we've got older animals. And it may vary depending on the type of management. So if we've got a confined setting, something that's penned up and hasn't moved, versus a free range where they come in at night or come in after whatever amount of time, that's going to cut down on the amount of parasitic burden. Or animals that are rotating pastures, that cuts down on it as well. Time of the year plays a huge role. Most of the time in the winter, we don't have internal parasite problems. We tend to have more of them. Again, typically going to be in the spring and the summer. We need to be careful when we're doing a parasitic program that we are careful about parasite resistance. That's our number one enemy. And we do have to consider withdrawal times if we're shipping these animals for either meat purposes or milk purposes. So, if we were looking at small animals, we'd be seriously concerned with tapeworms. For us in small ruminants, it's not usually that much of a problem unless you just have a huge parasite burden. And again, these are animals that can typically present with more than one parasite. So I would expect to find tapeworms potentially if I were finding other types of internal parasites, not strictly alone realistically. Lungworms, probably the one that we see most commonly, and they do cause bronchitis in sheep. They tend to have very thick, snotty noses. They struggle to breathe. These are animals that can, present with fever, cough, snot, just labored breathing, huge weight loss and loss of appetite. And it is a problem typically that starts with your 2 to 18-month-olds. Those are going to be your traditional population that would end up having these issues. Other ones that we have, and again, another fairly common one is going to be coccidiosis, and this is an aimaria. Coccidia exists pretty much in all animals. They just tend to be species specific. So it's a very common cause of diarrhea in lambs and in kids, and it tends to occur usually within 1 to 6 months of age. That's a traditional group. These oocysts can survive in the environment in a wide range of temperatures, and that's why it's an issue for us, because they do still tend to like the Southwest. So we do have problems with coccidia. Obviously, it can be a lot worse due to stressful situations. So, for example, animals that weren't really showing any clinical signs, they were acting fine, they were gaining weight appropriately, suddenly got weaned, or they got sold, or they got shipped, and then they come back and they start shedding, and that's when they start having the issues, and that's when you end up having that diarrhea develop. Mild cases, you probably don't see too many signs. Severe cases, they can present with obviously diarrhea, dehydration, weakness, and potentially even death. So the treatment involves using coccidiostats. We need to be very careful with these coccidiostats. And one of the things that you need to take into consideration is that many of the feeds that you buy already have coccidiostats. So you have to be cautious about what type of feed you're buying, because they are also used to promote growth. Usually, if they're being used to treat these animals, it should be given for about 4 weeks. Consistently, so that any of those oocysts can end up getting addressed. The problem is that we can develop a resistance. And so if you're using them to promote growth, you're going to have animals that are going to become resistant. And unfortunately, it's not as easy as saying, okay, well, if I never use it again, I'll decrease on the resistance and I'll end up having susceptible coccidia develop. That's not the case. Once that resistance develops, it's something that coccidia carries in its gene, and it passes it on to future generations. So once you're done, you're done. But if you have a situation where your levels are just way too high and these animals are not thriving, or you're losing some of your young stock, it's definitely worth going the route of treating them based on their body weight. So animals that can be treated are typically going to be used 30 days prior to lambing, and the idea behind that is that that will decrease the shedding of these coccidia in the feces. Therefore, their offspring will not end up ingesting them and developing the problem early. Another huge issue for us is going to be sanitation. This obviously plays a huge role. So either removal of manure or spreading out the manure, avoiding overcrowding. Those are going to be all good ways to control a lot of the internal parasites. Exposure to sunlight, as I mentioned before, here in the Southwest, we have a fantastic commodity, and that's the dryness that we deal with and the sunlight that we have. And they are the best agents that we can have to control some of these parasites. And they obviously, other things that you can do with these animals is minimize the amount of stress that they have and avoid the overuse of dewormers, so that you don't end up developing a resistance. So another one of the ones that we tend to run into, we said coccidia was a big one for us, usually happens in youngsters. Roundworms is a big problem for us as well. We tend to find roundworms. These are worms that go through five larval stages. The first 2 larval stages, they end up getting ingested. They come out through the feces. The first 2 are susceptible to extreme heat, extreme temperatures. They don't like it, they die. Unfortunately, the 3rd larval stage doesn't respond as nicely to that, and that's the one that can last in the environment for years. So when we say some species can survive 1 to 2 years in the pasture waiting for adequate conditions, those are the ones we're looking at. So we get a nice heavy rainfall, and that is exactly when it says, nice time to go ahead and develop. It'll go into its next larval stage. It'll end up leaving the feces. Animals will end up ingesting it, and they can actually carry the 4th and the 5th stage in their guts, not show any signs, and then they will actually present with the conditions. When the conditions are right, then they will begin to shed those eggs again. So again, it's one of the problems that if it's severe, it needs to be addressed. If it's not severe, or all you have is an older flock, there's no point in addressing it unless it's a problem within that group of animals you have. And part of the reason is, as we're looking at this slide, there's a huge resistance to dewormers. So there used to be a lot of money to be made in developing dewormers. We got into the stage in the livestock industry where there is very little profit to develop a new dewormer that's effective against everything, because of all the hoops that they have to jump through with the Food and Drug and all these different companies and licenses. And so we have very few new parasites very few new dewormers that are coming out. However, we have the issue with parasite resistance. So we have to be a little judicious about how we use a lot of these dewormers. So typically what we know is that roundworms are not evenly distributed throughout the population. About 30 to 35% of that flock or that herd is going to end up being the ones that carry the majority of the worms. The rest of them are going to be doing fine. They develop a natural parasite resistance. They seem to handle the parasites just fine. So those are not the ones that we're going to want to treat. The ones that we are going to want to treat are likely going to be animals that are either very young or animals where we're seeing that we're starting to have issues with weight loss, diarrhea, anemia. They're not growing the way we want them to grow. Those are going to be the ones that we're going to want to target. We also need to try to maintain a genetically susceptible population of worms. Again, so part of the reason, you guys have probably heard about the FAMACHA score, and that's one of the reasons why we try to keep some of those susceptible parasites around so that we can kind of dilute that whole resistance issue. So again, the idea is to treat the animals that are actually showing signs and leave the ones that tolerate that worm load. You can leave them untreated. How we manage them, you can identify the animals based on the body condition scoring. They tend to lose weight. They're not gaining weight. They tend to start looking pretty bony and ribby. Fecal egg counts is an excellent one. So taking a sample to your veterinarian and having them look at it is a great way. We treat the animals that are going to be anemic or that have a heavy worm burden. And we do want to make sure that any animals that are going to be going to slaughter are going to be treated. And then if there's a possibility for any sort of a pasture rotation, which we don't really seem to have here, that would be another option to treat these conditions. So again, there's different ways that we can deworm them. I'm not going to go too much into this one for the interest of time, but the ways that they have been handled in the past was you treat every single animal when it's being handled. So you're rounding up your flock, you're deworming everybody, you're vaccinating everybody, you're dehorning, doing whatever it is that you need to do, and that's when you're going to end up doing it. The second one is salvage deworming, which is where the animals are showing signs of illness, you go ahead and treat them, or you treat an age group, your weanlings, go ahead and treat all of your weanlings. Another one is going to be tactical deworming, which would be deworming 2 weeks after a heavy rainfall following a drought. So you would be looking at your summer conditions when we start getting into some of these monsoon seasons. That would probably be the time to target them. And the other one is going to be your suppressive deworming, which is treating the entire flock every 2 to 4 weeks. Unfortunately, with the suppressive one, it's time consuming, it's costly, and this is the one that more than all the others has a tendency to develop parasite resistance. So in general, when you're dealing with internal parasites, thankfully for us, many of them will treat multiple parasites at the same time. So you hit them with one thing and you might be getting rid of quite a few parasites in the process. So we've got 3 major classes. We've got benzimidazoles, imidazothiazoles, and tetrahydropyrimidines, and then we've got macrocyclic lactones. So realistically, the first one is going to be your typical valbazin, your Panacur. Those are going to be your fenbendazole and your albendazole. Second one's going to be more like your pyrantyl pamoate. That's going to be like your Strongid. And then the third one's going to be your ivermectin, your Ivomec. Those are going to be the typical ones that you'll tend to find. You want to make sure that you're not rotating name brands. You're rotating different classes. Okay, so you can't go with Ivomec today and then go with Zymectrin or ivermectin plus tomorrow. You have to rotate entirely, so you're not using the same one. And then you want to give appropriate doses based on the body weight of the heaviest animal. Okay, all of these have a certain range of security that's a little different from when we're dealing with coccidiostats. So you can kind of eyeball it and do an average. So you kind of set up your animals with small, medium, large, and that's what you tend to go to. If you're raising both sheep and goats, you're going to dose according to the species, and goats do require higher doses. Sheep have a tendency, you just go with whatever the sheep dose is and you're going to be fine. With goats, you tend to go higher because they just don't have, it doesn't work as effectively on them. One of the advantages that we have, you can use Poron and you can use it orally in small ruminants. You could potentially use injectable as well orally. Nasty tasting stuff, but it is something that you could go ahead and use. Okay, so different programs that we might end up using, for example, if we decide we're going to go ahead and deworm in the fall. You would deworm after hard freeze or at the end of a grazing season, and you could end up using something like a safeguard. That's going to be your fenbendazole, your Panacure, something like that. And then you're going to follow it with a moxidectin or an ivermectin. So your moxidectin is going to be your Cydectin. Ivermectin is going to be your Ivomec. Multiple days of the safeguard, what it ends up doing is kind of activates those encysted larvae. So then you come back with a Cydectin and you kill everything that's left. Winter, you could end up doing a fecal exam, for example, right around now, find out what your population looks like. If you've got a heavy parasite burden, you could go ahead and plan on treating. If you don't have a heavy parasite burden, then you would just go ahead and hold off on treatment. Spring and summer deworming, you could also do that. And you would begin the treatment 3 weeks after you turn these animals out. So your first deworming is going to be 3 days of safeguard, which we said was going to be your fenbendazole. And then you do another 3 weeks of safeguard 3 weeks after the first treatment. And then you do the third treatment with 3 weeks of safeguard and you give Cydectin. Okay. That tends to be a little bit on the hefty side. That'll pretty much cover everything, but it's obviously going to be time consuming. If you have a very large flock or very large herd, it's going to be fairly expensive and time consuming to go that route. Then the following year, you would go ahead and use a different product like a levamisole or an ivermectin instead of using your safeguard. So here's a list of your anthelmintic products. So all the different dewormers that you could end up using for their purposes, and it gives you, for example, for sheep, it gives you the body weight that you end up using and what your meat withdrawal is and what your milk withdrawal is. So these are typical. They're very easy to find on the internet. They're very easy to find on the label. And most of these products, you know, if you go to the maker of the manufacturer of that dewormer, they will have all of this information listed as well. So it's fairly easy to find. You just want to kind of make sure that you're sticking within the parameters that they're recommending and not overusing or underusing. So alternative control methods, obviously animals that are eating appropriately have better immune systems. You can try alternating multiple livestock grazing to kind of clean up those pastures. So wherever you had the sheep and the goats, next time around you put something else out there. So you put cattle out there and you move the sheep and the goats elsewhere. And that kind of helps a little bit because even though they may end up having multiple livestock parasites, each of these parasites is going to be species specific. So even between sheep and goats, there's some differences. Other option, pasture rotation. We already spoke a little bit about genetic selection, both within the flock. You want to select for those animals that are not showing signs. Or you want to select by breeds that are going to be more resistant to parasites in general. Excuse me. So moving on, when we're dealing with external parasites, a little different from internal parasites. Internal parasites tend to cause more of a problem in the summer and in the spring. External parasites are the ones that we typically see a lot in the winter. And part of that is because our animals tend to huddle closer together. They're dealing with a lot of the cold. There's an environmental stress factor there. So we tend to find, you know, not such pretty hair coats or fiber. And the way that we actually tend to find these is because we're seeing probably patchy looking hair, or we're seeing tufts of hair that, or wool that are falling out. So what we actually need to do is part the hair or the wool and observe the skin, see what all's going on there. Typical parasites that we could find are lice, mites, flies, keds, ticks, and nasal bots. Nasal bots we tend to find throughout the year. The others do tend to be, except for flies, the others do tend to be more of a winter type issue than anything else. So keds, widely distributed. They're very important, especially in sheep. They increase during the winter and in early spring. And again, this is mostly because the sheep are going to be confined to enclosed environments. And they can actually live for 120 days. They do damage the wool and the skin. So for people who are trying to harvest that wool, it's a problem. And these animals have a tendency to become unthrifty. They're just not gaining weight. Their wool doesn't look good. Unfortunately, the way that this typically spreads is you bring an animal that's affected by keds, and it just spreads like wildfire throughout the entire flock or herd. Lice, again, not all flocks have external parasite problems. So if you don't have it, you don't have a need to treat it. But if you do seem to see it, it can be due to carrier sheep, again, something that you brought in, or you have that one susceptible animal. And genetically, there are some animals that are more susceptible to others. These are animals that are typically rubbing and rubbing and rubbing. You notice that they might even draw blood, and they're definitely causing a hair loss. Treatments are typically going to be porons, so your pyrethrin, your pyrethroid, and in some cases, if they're heavy hair or heavy wool, you might need to go ahead and plan on shearing them. If you find this throughout the entire flock or the herd, it usually is indicative that there's some management issues going on that need to be addressed. So if you find the individual animal, I would likely blame it on susceptibility. If you find it across the entire flock or herd, likely there's, excuse me, something else going on. So in a nutshell, what we kind of have discussed today, and there you see a beautiful picture of blossoming diarrhea, is that we tend to look at different things when we're looking at entire herd or flock. We're not looking necessarily at just a specific animal. We're looking at the management that affects everybody. So a body condition tells you a lot about those animals. Are my animals being fed appropriately? Am I addressing their needs? Are they going hungry? Or is the quality of my hay too rich or not rich enough, or too poor? Or do I have competition going on? Do I have some animals that really just are not getting enough food and other animals are getting a lot more food? You know, so these are different things to look at. Wise thing to do is quarantine new animals. So ideally you would want to keep these animals probably separated for about 2 to 3 weeks, and we'll see that in another slide. You want to keep good records. They're going to be your most important pieces of information. Seeing any sort of discharge is not good. So snot's not good, coughing's not good, drooling's not good, diarrhea is not good. Any major weight loss and inappetence is going to be a problem. That's not good, and it's something that probably needs to be addressed, or you need to get to the bottom of it. And then ideally, if you can practice genetic selection for parasite resistance, both internal and external parasites, that's going to be ideal. You want to make sure you rotate dewormers, again, not within the same class, but within different classes. And you want to vaccinate against C, D, and T. So, new additions. You decide that you want to add a new gene pool to your current flock. Be very, very cautious. Don't bring any diseases home. So you go to the sale barn, you look at an animal, you're like, oh, just a couple of little crusts on the skin, it'll be fine. Don't bring it home. And if you do, separate it. Because if it's something potentially like ORF, which was the one that we discussed, the sore mouth, you're going to bring that home and you're going to take it to everybody. If they have something like CL, which is caseous lymphadenitis, where they tend to have abscesses, those abscesses can be both external or internal, and you bring that home, your herd or flock now has it. You bring home something that has diarrhea, you're bringing it home to your herd or flock. So you definitely don't want to bring either a carrier of disease or an animal that's overtly showing signs of the disease. If you decide that you are going to go ahead and do that, make sure you isolate those animals and keep them separate from your herd or flock at least anywhere between 2 to 4 weeks is acceptable. Usually you say 21 to 30 days. You want to make sure that you have a visual and hands-on examination of any new animals. So part their skin, part their hair, take a look in their mouth, make sure that these animals are trying to get away from you and acting like they should be acting and not entirely docile. You want to go ahead and treat and vaccinate and deworm 2 to 3 times with different classes of dewormer before you add these animals to your flock, okay? So you want to make sure that before they go in as a new addition into your flock, they have been treated for everything. And then you want to make sure when you're quarantining these animals that they don't have nose-to-nose contact, that when you're washing tubs, when you're cleaning their pens, when you're doing any of these things, that none of that runoff or any of that is going to end up blowing into your flock. You want to make sure that they are entirely separate. So just always be very cautious about that, because otherwise you're essentially not achieving anything by quarantining an animal very close to your flock. You're just going to be able to continue to spread the disease. So with that, are there any questions that I might be able to answer?
Thank you so much for that presentation. For those that are on here, feel free to unmute yourself, or you can insert your question in the chat box. While they're coming up with a question, I do have a question for you. As far as discharge in the eyes, how would you deal with say like lambs that end up having their lower eyelid rolled in? Is there anything that's like over the counter that could possibly be a remedy for this? Or
That's a really, really good question. So that type of an inner eyelid roll, that's called entroprin, and there is to a certain extent a genetic component to that. So what ends up happening is if you genetically select for animals that don't have a tendency to develop that, you get rid of it in your flock. If it's a mild case, and I've had some cases, there are different ways that can be handled. There's a process that's called skin staples, and that one works. There's one where you can actually, and typically somebody can train you to do this. You inject a little bit of penicillin on the lower lid, making sure you don't go in. And so the idea is that bulge will help that eyelid pop back out. And then as that ends up dissolving, then it goes away. There's a possibility of injecting saline. It's a little nerve-wracking the first time that somebody does it. And then there's a possibility of stitching that, so you have to be fairly confident about it. In situations like that where it's been rolled in and nobody noticed it, then you go ahead and you treat with antibiotics, but the idea is to try to eliminate that process. Most of the time those take care of themselves if they're being handled appropriately with some sort of either bleb or stitch or staple or whatever the case may be. Those will usually take care of themselves in about a week's time.
Okay, thank you.
You're welcome.
You had a hand raised here. I think the first one was Deb. Deb, would you like to unmute yourself?
Yeah. Hi, thank you. Our sheep are out grazing. I mean, our goats and our sheep, and we've never had this issue before, but we have long-haired goats, and we've noticed that recently, so we don't give them hay, and we notice that the sheep are the ones that like to eat the wool when the hay falls into their wool, but the goats never get hay. But we've been noticing that they've been eating each other's wool, and we're kind of wondering what's like, is this normal, or what should is there something we should be doing?
So the goats are eating goat hair, or sheep are eating sheep?
The goats are eating the goat hair.
Are you seeing any change in the quality of the hair at all?
One goat, they completely shaved her. They ate her entire hair off. and the other
Um,
ones are just patchy.
I would probably see if you might not have a little bit of a mineral imbalance. You probably need to take a look at your diet and see what you're offering them and find out if there's something going on there. Take a look at the quality of the skin and the hair, because to a certain extent, there can be a behavioral component, and once it develops and it turns into a source of fun, you're going to end up having it. But usually that should be, maybe occasional, not to the point where you end up having somebody who's entirely hairless, courtesy of everybody else. So I would probably see if you might not have some sort of a dietary or mineral imbalance going on.
Okay, yeah, because this is the first time out of all the years we've had goats that this has happened. So we're just like,
Yeah, and I'm wondering if it might not even be related to the fact that you're not offering them hay. You might try that as an alternate source, just a fiber. I'd probably say something that's a fairly mild form of hay that's not going to be too rich for them. And
Okay.
see, you'd have to do a slow introduction, but see if that doesn't cut down on some of the issues with that.
Okay. Thank you.
You're welcome.
Okay. Thanks, Deb, for that question. We have another hand raised, and you have questions in the chat box right after. Jerome, would you like to unmute yourself, please?
Yes.
Thank you.
Good evening, and thank you. My wife and I are just starting to venture into the goat realm, and the one thing that we've ran into is CL. And there's information out there. I'm not sure people, I don't know, our questions kind of what is it? How does it apply? There's a vaccination, both live and dead, that's available. We've run into breeders that have it in their herd. Should we bring those home into our herd, assuming they don't have it, or that they do, and vaccinate? What are the dangers of vaccinating? Some people vaccinate at a young age so that the animals, they've never seen it in their herd, but they vaccinate. So I assume that's why they're not seeing it in their herd. I'm just really confused. I heard it's very prevalent in the Southwest, and it's not a nice thing to see in your herd. So I've got a million questions. My wife and I have a million questions. I know that you briefly touched it, and I'll shut up at this point.
Okay, so yes, and yes. So unfortunately, it is very prevalent in the Southwest. Sadly, disappointingly so. Couple of things about CL. If you're going to have it in sheep or goats, you would rather have it in goats than in sheep. But if you've got the two herd and flock mixed together, you're going to end up likely having it. Once it's in your herd, you've got it. You're not going to get rid of it. You might cut down on the number of abscesses you have, but once you bring one animal in that has it, the likelihood that it's going to spread to the rest of the flock or the herd is very, very high. As far as the vaccine goes, the vaccine, either using the dead or the live vaccine, is something that you would use. And again, it's going to be a risk-based vaccine. And it's going to be something that if it's already in your flock, you might try to use it. It is an extremely painful vaccine to give. They're very unhappy with it. You better have some sort of ear protection when you give it. And realistically, those animals are all going to essentially become positive or come up positive. So how much cost versus benefit, whether or not you would go that route, I don't know. Personally, flocks that have, or herds that have CL, in my opinion, as a producer, I would like for somebody to disclose that to me and tell me, this flock has had it. It's something that we deal with. We don't have too much of a high incidence, but just so you know, we've got it. But I've seen it happen both ways. I have one group of people that I work with, and they had one of these goat herds that had come from multiple locations, and they just happened to go to the right sale barn, pick up 5 animals, and it just spread like wildfire. And so now their herd is considered to have CL, and it's not something that's going to go away. You can try culling animals. You can try separating the kids so they don't even get colostrum, and hand raising them or bottle raising them. It's miserable. It is actually miserable. So realistically, it's a question of how much you want to deal with it or you don't. If you don't have it in your herd or your flock, you don't want to bring it in. So you always want somebody that is a trusted individual for you. But once you have it, it's going to be in your herd or flock forever. And as far as culling those animals, it's not always such an easy decision to make. You know, it's something that, for example, if you're selling goats for meat, that whole carcass is not going to be condemned because of one lesion. That lesion will go, and then the entire carcass could still be used for food. So it's a little bit of a judgment call when you're dealing with CL. Hope that answered your question.
I think it is. It's a lot to consume. Basically, you know, we haven't brought the animals that have CL into our herd.
Right.
It was disclosed and we saw it on site, and even scared us just to be there. But
Yeah.
then it was disclosed that it's everywhere. And this individual told us that, you know, I'm pretty sure it's everywhere. I know of one breeder that doesn't have it, and I don't believe him. You know, that's what I'm hearing.
Right.
So,
Right.
but you know, you're talking personal breeders, individual, you know, people that have them somewhat as pets. These are boar goats.
Right.
So there's
Yeah.
a lot to cover with that, but they don't seem to have had it. But like I said, they told us they vaccinate the lambs, but they didn't say anything about, or the kids, but they don't. It sounds like they don't do it annually, and that's something that I think also comes along with the vaccination. So I have no idea.
Right.
I'm just confused
Well,
with how it scares us or worries
the
us.
CL vaccine is supposed to give you immunity for about 3 years. I don't
Okay.
know how much I trust it or don't, but once you get into the vaccination protocol, you're pretty much going to be stuck vaccinating. And that's probably why they do their kids, is they probably got everybody else who's already been vaccinated or immunized or has shown the disease, and now they're just keeping their young stock up to date, which is a sensible practice. It really is. Again, if you don't have it, you want to keep it away as much as possible, unless it's a genetic component that you really, really want for your flock, or your herd, but you really have to anticipate that you're going to be dealing with CL.
Okay. Do you think that vaccinating an animal that already has it, say you don't know it, but it already has it, would that stop the lesion flare-ups, or have a possibility of doing that? Or is that just wishful thinking?
Frankly, yeah, I don't think so. I think once
Okay.
you've got it, you've got it. And again, even with a live vaccine, once you've got it, you've got it. So I don't
that's the
know
other
that you would necessarily have fewer issues with it, frankly.
There's no way to tell other than to test. And if they've had the vaccine, they would test positive. So
That's correct.
you're like in a lose-lose situation. Even though
Yeah.
they may not have it, they're going to test positive regardless. So,
Correct.
all right. It's just as
All right.
confusing as I thought, and we appreciate your.
Sorry
I'll let
about
someone else.
that. All right. What other questions do we have?
Thank you, Jerome. We have some questions in the chat box, starting with Bahi Rumhorse. How do you treat early stages of mastitis?
Oh boy. Mastitis is a difficult one. Realistically, in a perfect world, if you have the opportunity to milk those animals out as much as you can, if you have the opportunity to go ahead and actually use an intramammary infusion, that's going to be the best option. Putting them on antibiotics for longer periods of time is going to be probably the most sensible option. Sometimes you manage to get it to clear, sometimes you just absolutely don't. It's heart-wrenching to find animals that you just can't clear from mastitis, and those are typically animals that are going to get culled from the herd or the flock. But if you can catch it early enough and you can actually do intramammary infusions, those are probably going to be one of your biggest helps.
Okay. Well, I hope that answers your questions, Bahi. We do have some questions from Alyssa and Loretta. They both have questions as far as sheep bloating, and they want to see if you have any recommendations or suggestions for sheep bloating.
That's another really good question. To avoid sheep bloating, you're probably going to need to look a little bit at your diet and see what all you're feeding and how much you're feeding of it. You don't want anything that's going to be particularly rich. You don't want to make any radical changes to diet. So, for example, if you're looking at hay, you want to make sure that you have consistent hay source that'll take you through the year, whenever it is that you're feeding. Gradual introduction of any changes in feed, that's going to be a good way to do it. When you actually have a bloated animal, you're still going to end up relying on good old-fashioned TheraBloat, and that's going to be a good option. There are some people who will potentially pass a tube on some of these animals to get them to get rid of the bloat. But again, more than anything, I think you try to handle it from a nutritional standpoint. Make sure that you don't have animals that are over conditioned, and that they're getting appropriate amounts and reasonable amounts. So any radical changes in feed are probably going to be the first thing that will help you, that will have an issue with the sheep bloating.
Okay, all right. We do have another question from Lenora. What is the best time to vaccinate your flock?
Okay. Again, best time to vaccinate a flock is going to depend a little bit. One of the things that we had discussed, and when I make that presentation available to you, it might make a little more sense, but a lot of it's going to depend on when you end up kidding or lambing. So you want to make sure that any of your pregnant ewes were typically going to be vaccinated 4 weeks prior to kidding or lambing. And that is so that they can actually build the immunity for their offspring. Once that offspring is born, there are a couple of different ways that it can be handled. Usually you would try to give a vaccine, the first vaccine to those kids or lambs approximately 2 weeks before you're weaning them, and then go ahead and give them a booster after that. But it also varies. You know, people will wean at different times. Some people will wean as early as 1 month, and some people will wean up to 4 months later, you know, and so depending on where it is that you're weaning, your best, the best ability for that lamb or for that goat to develop an immunity is the older it gets. So occasionally there are going to be some people that will actually, if they're weaning particularly early, say they're weaning at about 4 weeks or 6 weeks, then they may end up giving up to a third booster. Okay. Another thing to take into consideration is when you're doing bottle babies, typically most people will do the CD&T in additional time just because they don't have that level of colostral immunity. And does, well, I would say kids not as much, but lambs have a very unthrifty immune system. It's not one of these, let's fight every disease known to mankind. It's one of these, if it's not exactly the way it needs to be, I'm going to wither and die. So kind of based on that lack of good immunity that they end up developing, you might be better off doing an additional booster on that. And then the other thing that we mentioned regarding vaccinating flocks, those are going to be your typical vaccines. So on the ewes, 4 weeks before they, or on the does, 4 weeks before they end up kidding or lambing. And then you're going to do the youngsters 2 weeks before you wean them, and then you give them a booster. On rams, bucks, wethers, anybody else, just an annual. So whenever they got past their baby shots, they just have an annual booster, and that's it.
Okay. Thank you. I hope that answered your question, Lenora. Well, this has been a great evening presentation. Thank you so much, Dr. Eknoff. I really appreciate your time for presenting this to us this evening. So much appreciated. And
you're very welcome.
yeah, thank you. And for those that have hopped on here, we did reach an end, but this webinar is being recorded and we will share this on our social platform. So be on a lookout on our Facebook page and YouTube channel. If you're subscribed to our YouTube channel, it should already give you an update when we share our webinar recordings. But with that being said, we'll go ahead and continue on to our announcements. Next week, we are going to have tree pruning basics webinar. This one's also going to involve fruit trees. This is going to be on February 20th. Like all of our webinars, sorry about that. They all start at 5:30 and roughly around 6:30 p.m. and a little bit after. It all depends on how many questions we have, and all of your questions are really, thank you all for getting all of those questions in, and this is what our presenters look forward to. This is the information that we give you, and they're more than happy to help you guys navigate through certain concerns that you guys may have with your projects and such. So thank you all for tuning in this evening. This presentation for the tree pruning basics will be presented by Dr. Thompson. She's the NMSU garden specialist, so she'll be our presenter next week. I did send out a poll survey to each and every one of you. If I could get you guys to take a minute out of your time and answer those questions for me, I would greatly appreciate it. And let's see. And I know I did talk about this in the beginning, and it's not letting me move it. Okay, there it is. So most of you guys may not be aware of this, but we do have a website. It's called the nsa.nmsu.edu. And basically the first larger screenshot that you see right there is our main webpage. And what you see on the right side will be a bunch of tabs, meeting the team, all of us, as well as our previous, our project, as well as our conservation planning program that we have got going on. So if you have anybody that would need some assistance in their conservation plan, please let them know that we are able to help them in the system, as well as upcoming events. So all of our upcoming events are updated up there on our website. So feel free to look around on our website. It's there for you guys. We do have the tree pruning, like I mentioned, next week, and the following week after that is bull selection. Then the week after that, we have landscaping with native plants. So the registration pages are all on there. You'll see it highlighted in red. It says register here. We also share some updates on our Facebook page just to let you guys know that this is what's going on this week and the following week. But that's all I have for you guys. So thank you so much for everyone for tuning in this evening, and hopefully you guys have a good rest of your night. Thank you. Thank you all for joining us this evening. My name is Mikal Lantana. I am the field specialist for the Navajo Sustainable Agriculture Project. In short, we call it the NSA project. We also have Ms. Jessie Jim. She's our field coordinator, and our project director, Dr. Michael Patrick. So thank you all for joining us for the sheep and goat vaccination and health management webinar. This presentation will be presented by Dr. Alexandria Eknoff. If I'm pronouncing that wrong, I'm deeply sorry about that. But before I hand the floor over to our guest speaker, I want to give you guys a quick introduction just to who we are as a project. Let me see if I can work my slide. There we go. Okay. All right. Well, the Navajo Sustainable Agriculture Project, in short, the NSA project, is a New Mexico Cooperative Extension Service initiative delivered in collaboration with two of our main partners, COPE and Dene College Land Grant Office. Our project is funded by the USDA Outreach and Assistance for Socially Disadvantaged Farmers and Ranchers and Veteran Farmers and Ranchers program. And going on to the next slide. So the basic goal of the NSA projects are to improve our Navajo farmers and ranchers' knowledge in accessing and available programs and technical assistance and services provided by USDA programs. And some of you may know, well, all of you may know these programs like the NRCS, the Rural Development Risk Management Agency, Farm Service Agency, and so forth, and those other resource providers, such as Department of Agriculture here on the Navajo Nation, the Agriculture Infrastructure Fund, and so forth. And as well as increasing the local production and consumption of fresh fruits and vegetables and healthy foods by Navajo families and individuals through our gardening programs. So ways that we accomplish these goals, the NSA project is committed in providing our producers with agriculture workshops, such as our weekly Zoom webinars that we host every week. We do alternate them from livestock topics to gardening and crops. and so forth. And our webinars are recorded and posted on our social platform for you guys' use. We also provide monthly newsletters that entails previous workshops and summarizes what the presenter has had to present that day, as well as USDA programs from FSA and NRCS, what's available and what type of projects that they're doing as well. And we also provide field day demonstrations. We're starting to kick off this year again to start getting our foot through the door and meeting with you guys in person with livestock first aid trainings to farm planning with our project partners. And we also include individual technical assistance with production, management, completing BIA and other natural resource conservation plans, farm and ranch plans, and so forth. But all this information I'm giving you guys can be visit on our webpage at nsa.nmsu.edu for more information and upcoming events. If you guys are interested or know someone that would need some technical assistance on conservation plans, do give us their information or have them contact us. But that's all I have for you guys, to an overview of who we are. Thank you so much for tuning in this evening.